If you have already tried physical therapy, injections, and several different medications without lasting back pain relief, you are not at the beginning of this journey. You are the patient modern spine care has been built to help. If you're sitting there nodding your head right now, just feeling that deep, deep sense of exhaustion from trying literally everything and getting nowhere, I want you to know right off the bat, we see you. You've shown up, you've given every single treatment a fair shot, and yet the pain is still running the room in your life.
So, welcome to The Explainer. I am so thrilled you're here with us. Today, we're taking a structured, really highly visual deep dive into the evolution of modern spine care. We're going to completely reframe how we look at chronic, treatment-resistant back pain. We'll be breaking down some pretty fascinating medical insights to show you why a long, super frustrating medical history is actually the key to unlocking your very next steps.
All right, so here's our roadmap for today's explainer. 1. The chronic pain journey. 2. Reframing resistance. 3. Matching care. And 4. The Vertrae evaluation. Okay, let's dive into this and bring a little order to what often feels like a completely chaotic medical maze.
Section 1. The chronic pain journey. The standard loop.
Okay, so most patients with chronic back pain are handed a fairly standard playbook. It's kind of like a loop. It usually starts with rest and some over-the-counter meds, then, you're sent to physical therapy. When that plateaus, you might get stronger medications, maybe an injection, and then, you're often sent right back to repeat the whole shebang. Now, don't get me wrong, this sequence is completely reasonable at first. It actually helps a lot of folks. But for the patient whose pain just hasn't responded, repeating the exact same loop on round 4 simply leads to the exact same frustrating plateau as round 3. And the data absolutely backs up this plateau. Think about this, a massive 2024 systematic review of 95 studies, we're talking roughly 18,000 patients here, found that low back pain lasting longer than 12 weeks tends to follow a really specific curve. Pain improves modestly in those first 6 weeks, but after that 12-week mark, it just plateaus. Patients with persistent pain see only tiny, small changes over the following year with usual care. So your lack of progress after 12 weeks is definitely not a failure of your effort. It's simply the reality of how chronic pain behaves when it's stuck in that standard loop.
Section 2. Reframing resistance. From failure to clues.
Okay, here is the absolute first thing you need to know today. The patients who have tried the most are often the patients with the most diagnostic information. Failed and temporary treatments are not failures. They are clues. Let's just look at the phrase treatment-resistant for a second. It sounds so final, doesn't it? Almost like a life sentence. But actually, scratch that. Treatment-resistant does not mean untreatable. Not at all. It just means the pain hasn't responded in a lasting way to the usual first steps. It's simply a description of where the journey has gone, not a verdict on what comes next.
We literally need to flip the script here and move from the old mindset to the new mindset. The old way of thinking basically says, hey, if a treatment didn't cure you, it was a failure and it was wasted time. The new mindset recognizes that you aren't a blank slate. You are bringing incredible, hard-earned evidence to the table. Every single failed treatment is a vital diagnostic clue for exactly what to do next.
It helped at first, then stopped. Man, this is one of the absolute most common things patients say in a spine consultation. And honestly, it is so incredibly frustrating to get a taste of relief only to have it snatched right back away. But here's the secret. Temporary relief is highly diagnostic data. Treatments sometimes help for a while and then stop. That pattern is itself diagnostic. It tells a careful clinician something huge about what is and is not driving your pain.
Notice how unbelievably specific these clues can actually get. If you had an epidural injection and it helped for a couple of weeks, that tells us regional inflammation was definitely part of the story. If a medial branch block gave you clear, short-term relief, boom, that points the finger directly at facet joint involvement. Even if physical therapy only helped briefly, how your body responded points toward very specific movement patterns. None of these treatments failed. They simply acted as a temporary spotlight on the actual root cause of your pain.
Section 3. Match and care, the modern approach. So if we aren't just going to push you through the exact same standard loop again, what does modern medicine actually do? Well, modern spine care is emphatically not try harder. It is match the care more carefully. It's never just repeating the same standard care sequence and keeping our fingers crossed for a miracle. Instead, it is all about tailoring the approach directly to your specific risk profile and your incredibly unique pain patterns.
Modern options are vastly broader than they used to be for sure. Stratified care, structured rehabilitation, supported self-management, and newer targeted procedures all have a role for carefully selected patients.
For example, there's this fascinating 2026 trial in JAMA called the PACBAC trial, which showed that structured, clinician-supported self-management programs significantly reduce disability compared to just standard medical care. Plus, there are highly targeted diagnostic and interventional procedures today that simply weren't even part of the conversation a decade ago. It's a real game changer.
Which leads us to a highly provocative, totally crucial question. Has anyone actually stepped back and looked at the whole picture? I mean, you've had the meds, you've done the PT, the injections, but were they just a checklist, or did someone actually connect the dots? When you're dealing with treatment-resistant pain, asking, what else should I try, is kind of the wrong question. The right question is whether your entire fragmented history has been viewed as one cohesive map.
Section 4. The Vertrae Evaluation, a comprehensive review.
Let's look at a specialized, structured solution designed specifically to connect those dots for you. At Vertrae in Miamisburg, Ohio, Dr. Kamal Woods reviews the full treatment history before recommending anything new. He doesn't just look for what failed, he reads every single partial response as super valuable data. The exam, the imaging, the response patterns, and most importantly, the patient's goals all completely shape the plan moving forward.
When Dr. Woods takes that second look, he's actively hunting for treatable categories that might have just been completely ignored in the past. We're talking things like modic changes, which are specific bone marrow signal changes near the disc, or multifidus dysfunction, where the deep stabilizing muscles of the spine have kind of lost their coordination. These are specific nerve-related pain patterns that have dedicated, targeted treatment pathways today. If you were told 10 years ago that nothing more could be done, well, these exact factors likely weren't even on the table back then.
Please take this to heart. A second look after a really long journey is absolutely not starting over. It is building on the work that has already been done. Every step you took, every treatment that faded, has paved the exact path needed for a focused, modern evaluation. Your history isn't a list of failures, my friends. It's your personalized medical map.
I really want to leave you with this final thought, summarizing our explainer today. If you have tried many things and the pain is still running the room, a focused evaluation at Vertrae in Miamisburg, Ohio may be the next step worth taking. Seriously, what if your years of so-called failures are actually the exact blueprint needed to finally solve your pain puzzle? Thank you so much for joining me today. Keep learning, and I'll see you next time.